Assalamu alaikum. My name is Nimr Ibrahim and my group number is 7. Topic of our group is nausea and vomiting. This topic which I'm going to present in this presentation is radiation-induced nausea and vomiting. So first we will see that what is actually radiotherapy. Radiotherapy is a treatment where radiations are used to destroy the cancer cells. There are many ways we can receive the radiotherapy, but they all work in a similar way. And the main purpose or the aim that why we are doing the radiation therapy is that we want to stop or prevent the growth and spreading of the cancer cells in the body. The patients who are receiving the radiation therapy may also experience some side effects, which are feeling tired, skin reactions and discoloration, hair loss depending on the area being treated, loss of appetite and problems in eating, feeling sick, unwell, nausea and vomiting. And this is the main side effect which we are going to discuss in this presentation. So how does the radiation cause nausea and vomiting? Radiation sickness occurs when high energy radiation damages or destroys retained cells in our body, and the regions of the body most vulnerable to the high energy radiations are the cells in the lining of intestinal tract, including our stomach and the blood cell producing cells of the bone marrow. As we know that when the patient is receiving the radiation therapy, the radiation does not only destroy the cancer cells, but they also destroy the normal body cells also. Radiation-induced nausea and vomiting. Radiation is one of the treatment modalities used for the management of the malignancies. One of the side effects of the radiation therapy is radiation-induced nausea and vomiting. Nausea is a serious side effect of radiation therapy that can impact the patient's quality of life. It is estimated that radiation induces nausea and vomiting in 50% to 80% of the patients. Here is the case study. EG is a 54-year-old man with newly diagnosed head and neck cancer who will receive radiation therapy concurrently with chemotherapy containing cisplatin and fluorouracil. His daily radiation treatment will last for 6 weeks, although it is not going well after EG's nausea and vomiting from the chemotherapy subsides. So here the question arises that is he at risk for developing the radiation-induced nausea and vomiting after his nausea and vomiting from the chemotherapy subsides? So we will see. The gender is male, his age is 54 and he has heavy smoking history. What assessment we can make that radiation therapy can cause nausea and vomiting through the same basic pathways that the chemotherapy does. And the radiation-induced nausea and vomiting affects 40 to 80% of the patients receiving radiation therapy. The risk of radiation-induced nausea and vomiting depends on several factors, namely the size and area to be irradiated. So the patients whose irradiation area is greater than 400 centimeters square are more likely to have the significant symptoms. Patient receiving radiation to the upper abdominal area experience nausea and vomiting about 50 to 80% of the time. So the main factors upon which the radiation-induced nausea and vomiting depend is the area where the radiation is delivered. And the intensity of nausea and vomiting varies along with the body parts. So by this we can say that EG is not at high risk for developing radiation-induced nausea and vomiting because his radiation site will be in the head and neck region. What are the risk factors for radiation-induced nausea and vomiting? The severity of nausea and vomiting induced by radiation depends upon mainly on the area where the radiation is delivered, and different body parts having different severity, having different risk for developing the radiation-induced nausea and vomiting symptoms. So if the patient is receiving the total body radiation has the highest likelihood of inducing nausea and vomiting. The radiation delivered to the upper abdomen incurs the second highest risk. Radiation administered to the thorax, brain, or head and neck is considered at low risk. Increasing the body area being irradiated, the radiation fraction used in the overall total dose of radiation administered will alleviate the risk of radiation. So, in short, that the nausea and vomiting symptoms depends upon in which which area we are going to radiate, at what dose we are using for the radiation. So we can see the plan that prophylaxis for radiation-induced nausea and vomiting. If the patient is receiving total body irradiation, his emetic risk will be high, that is above 90%. And in that case, the recommendation will be serotonin antagonist, ondansetron 8 mg IV plus dexamethasone 4 mg by mouth daily. But if the patient is receiving the upper abdomen radiation, then his emetic risk will be moderate, 60 to 90%. Then the recommendation for that patient will be prophylaxis with serotonin antagonist chlorpromazine 25 mg thrice a day. If the radiation area is lower thorax, pelvis, cranium, radiosurgery, craniospinal region, then the emetic risk will be 30 to 60%, that is low. And in that case, the recommendation will be prophylaxis or rescue with the serotonin. And the patients who are receiving the radiation in the head or neck, extremities, cranium, and the breast region, then the emetic risk will be minimal, that is less than 10%. And in that case, the recommendation will be rescue with a dopamine antagonist or a serotonin antagonist. So by this, we can see the patient who is receiving the radiations in the head or neck region is at very minimal risk for developing the radiation-induced nausea and vomiting. So EG is unlikely to develop the radiation-induced nausea and vomiting symptoms because he is suffering from head and neck cancer, in which the risks are minimal, so he does not need any prophylaxis with serotonin antagonist, as we have discussed in the previous slide. So if he develops symptoms later, then the rescue therapy with ondansetron, which is a dopamine antagonist, or chlorpromazine, which is a serotonin antagonist, should be given. But these treatments will be given in that case if the patients develop symptoms. But as he is undergoing low risk radiation therapy, then we can also offer him with dexamethasone of 16 mg daily, oral or IV. And how does the dexamethasone will be useful for this patient is dexamethasone is actually antagonize the prostaglandin or release the endorphins that alleviate the mood, improves one's sense of well-being, and stimulate the appetite. That is why dexamethasone will be helpful in this condition for the patient. So what we conclude this, radiation-induced nausea and vomiting can be a serious side effect which may adversely impacting the patient's quality of life and potentially compromising treatment, because the patient who experiences this severe nausea and vomiting might refuse the subsequent radiation therapy. Therefore, prevention and treatment are important to help avoid alleviate the symptoms of radiation-induced nausea and vomiting, because if the symptoms alleviate, so the patient may the patient may refuse to take the further treatment. So we have to prevent the symptoms, or we have to avoid the alleviation of the symptoms in order to continue the treatment of the patient. Thank you.